what is our patient's starting position? Slight extension, or arched forward is what I like to say. Right? Now, if we are assessing for facet closing and or an extension dysfunction, what position is our patient starting in? Slouch, slouch, slouch. Yes. All right. Now, I'm wondering, would it be easier? Okay. So we are going to go ahead and pretend that both of her dysfunctions are on the same side, so you can see the difference difference in what I'm applying as a practitioner. Okay, because if I go on opposite sides, it might be a little bit confusing because I'm going to stay on the same side for opposite side dysfunctions. All right, so for the sake of demo, we are going to pretend that Sharon has a dysfunction on her right side in both flexion and extension. All right. So we are going to go ahead and we're going to landmark. First, we're going to get you in a bit of a neutral here. Okay, and now Sharon, I'm going to get you to go ahead and arc your back forward first, other way around. There we go, arcing forward, good. And now go ahead and flex forward. And slow, 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 slow. Keep going, keep going. A little more. Keep going. There you go, good. And back up. Good. Actually, you know what? The right side is actually kind of stuck in flexion. And now go ahead and go forward again.
Forward, like this.
And now bend forward. Good. Good. And then back up. And an extension. How interesting. So okay, we found one. I don't know what level I was at, but we'll use that level. I could have counted and figured out what level we were at, but you know what? This is just for the sake of demo. Okay, so for an flexion dysfunction, that means she is having trouble with doing what? Opening. So we are going to assist her with opening that facet. Okay, what are the directions that we want to utilize in order to open her facet that is on the right?
Flexion, away from and then rotation.
Correct. All right. So with that in mind, this is the direction that she is going to be in. This is the position you're going to be pulling in as a practitioner, which means this is the side that you're going to be sitting on. All right? So go ahead and we'll go back to neutral. Good. Okay, so Sharon, we are going to be demonstrating a variety of techniques which will require me to place my hand across the front of your shoulders as well as placing my hand around your back with your arms crossed across your chest. What we're going to be doing is we're going to be doing some mobilization techniques in the mid-back area to help encourage some segmental mobility in your back. There's a chance we might possibly recreate some discomfort for you, but it will hopefully give you some relief. Do you have any questions about what it is that we're going to be doing? Do I have any permission to continue?
Yes.
Wonderful. Okay, I'm going to go ahead and cross your arms. And we're going to go ahead and landmark that one position that one vertebra that we're targeting. So I'm going to get you to arch your belly forward. There we go. Good, and now I'm going to get you to go ahead and flex forward, please. Slow, slow, slow. Good, there, stop. Good. So she's flexed forward until we feel that vertebrae lift, but not the one below it. We're going to get you to nice and slowly. I'm going to get you to side flex this way, nice and slow, 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 slow. Keep going, right about there. Good. And then we're going to rotate. More, there. Okay. So that segment has been open in all of those areas. I'm still keeping my thumb on the landmark that we are going to be addressing, and now I'm going to go ahead and apply the MAT. All right, Sharon, when I say so, I'm going to get you to go into the opposite of all three of those directions, trying to bring yourself against the middle, and I'm going to try and resist you. Okay? Go ahead and slowly activate and pull. 5, 4, 3, 2, 1. Let go. Breath in. And when she relaxes, we try and bring her even further forward flexion, side bend, and rotation. And our thumb is going in an upwards motion, like we're trying to open that stubborn facet. Okay, once we got a little bit of motion, we're going to get you to go ahead and try and extend, rotate, and flex back to center. Hold. 5, 4, 3, 2, 1. Let go. Breath in. And let it fall. Good. Flex. Rotate and side bend, and we're trying to open. It's pretty forceful, like that point of the thumb is actually pretty intense. Anybody remember that? No. Okay, so we're gonna go back, reset into center. So now we've addressed the forward flexion. What's the last thing we want to do after we apply our technique? Reassess. 10 points for Mark. Oh, and Sharon. Okay, I'll get you to belly forward. Good. Okay, and I'll get you to flex forward. That's better. That's more symmetrical. That's good. All right. So now we're gonna go ahead and address this segment here in extension. With extension, we are trying to assist with what motion? Closing, extension, yes. All right, so our starting position is gonna be slightly flexed forward, so slightly flexed forward. Good. All right, Sharon, I'll get you to go ahead and extend backwards for me, please. Slow, slow, slow. Let's go back forward, that was a little bit too fast. And go ahead and extend. Right there, good. And then we're gonna go ahead, and we're trying to close this one, so we're gonna go which way? Toward the side that we are addressing. Good. And then we're gonna rotate toward. So right now we're jamming that facet closed, right? So we're gonna keep our landmark there. This time I'm sitting on the opposite side. Okay. And now Sharon, I'm gonna get you to go ahead and try and flex forward and try and get to the middle of our resistance. Go ahead and push. 5, 4, 3, 2, 1. Let go, back in. And out. So bring her further into extension, side bend, and rotation. And it's literally like you're trying to jam into that segment that you're addressing. Okay? Try and go ahead and flex and side bend, rotate. 5, 4, 3, 2, 1. Let go, breath in. And further extend, side bend, and rotate. So literally it feels like I'm digging my thumb into her back. Is that what I felt it? Okay. So now what do we do?
Reassess.
Reassess. You got it.
And
Right, so slightly slouchy, slouchy, slouchy. Good.
did I pass the midterm OP?
There is no midterm OP.
Yeah.
But yes, you have. Go ahead and extend. It's more moving more symmetrically now. Yay, we did a thing. Great job, Sharon. Okay, any questions about that? Adam?
During your assessment, how do you know if it's like normal?
Just by the equal movement. And plus,
So
if you're gonna,
pump it all the entire spine.
you probably a few of them. Yeah, you wanna see what normal movement feels like and then compare that, and then you'll find one that doesn't feel like it's moving like the rest.
When would you do this? Like
During treatment?
assessment or during treatment?
So for this one in particular, it depends, really. It depends on what else you have in the roster of what you're gonna be targeting. If this is their primary issue, you can actually do this pretty much right at the beginning, if you really want
You
to.
don't need a warm wash?
Hmm?
Yeah.
You don't need a warm wash?
Yeah, not really. Yeah. It would be easier, don't get me wrong, for you and your palpation skills to be able to actually feel things happening. It might be a little bit easier for you to go ahead and do actual treatment first. But yeah, no, this is one of those techniques that you can actually get right in and do right away.
So like I could do this at the start and then be like, okay, now we're gonna go into like our regular treatment. You can run this blah blah blah.
You could, but I would be mindful about if you're being examined for a situation that this class doesn't matter because we're just going to ask you to demonstrate it, right? But if you're being tested, like say skills check or formal down below, I do suggest that you do this at the end, just because they'll see your principles of treatment, warming up the tissues, all that stuff. But in terms of effectiveness, you don't have to. But in terms of principles of treatment, making sure you're following all the things, you have to, right?